everyone, welcome to Dr. Michelle's live class on the basics of essential oils. I hope that everybody's having a great day. And first I want to start with an introduction and then we're going to dive into the good stuff with the basics of essential oils. So I'm Dr. Michelle, doctor of Chinese medicine, doctor of acupuncture, Chinese medicine, licensed acupuncturist, both state and nationally licensed. And I also have a registered nurse degree. So I was a surgical nurse for many years, perioperative certified, and plastic surgery was my specialty. So I picked a really fun field. So I've been treating patients for about 30 years. I'm going to give away my age here, a long time. And I found my passion. I loved treating patients. And right now, currently, I have two office locations. One is out in San Diego at a local hospital, and then another one is my private practice, which is up in the Del Mar East area. So, and I do take insurance at both locations. And then now I'm also offering telemedicine and all consultation via the phone or via a Zoom meeting. So we're doing, more safe practices with the COVID crisis. So I do screening too, and we're doing screening at the hospital. So everybody's pretty safe as we go forward here in our new era. So I wanted to start with essential oils, the basics. So what are essential oils? Essential oils are plant parts, and they're the aromatic compounds that are extracted from plants, trees, leaves, flowers, bark. So really just all that great plant life out there. And it can be distilled in various ways, steam distilled or cold distilled. And then there's three different ways that we can use essential oils. And that's with the particular brand that I'm going to be using today. When I first started my medical practice, herbology is 50% of my studies in my medical degree. So I prescribe herbs, and then I was so blessed to fall in love with essential oils even more so as I was introduced to Doterra's oil company. And with both of the companies that I use for my Chinese herbs and for the essential oils, I feel like they're just the top notch. They both do a lot of quality testing, third-party testings, multiple testings inside and outside of their facilities. So I feel like that way we're getting, I'm prescribing the purest product, and I'm also taking the purest product. So the beauty of essential oils with doTERRA is that they're certified pure therapeutic grade, which I do mention in my last video last week, my personal story in sharing essential oils. I do share about that they are CPTG, meaning certified pure therapeutic grade, and that just means that they have no pesticides, fillers, chemicals, additives to the oils. So a lot of them can be ingested. And you'll know that if you start to use doTERRA's essential oils, is they'll have a supplement label on them. But it's also good to get with your medical practitioner, me, if you choose that to be me. And then, we can go over the appropriate dosing and prescribing. And there's various ways which I'm going to break down that topically, and ingesting, how you can take those. So please don't go out to the store and start ingesting oils, because typically those are not pure, even though they may say they're pure. A lot of times they only have about 5% of the pure oil in there. There's no really standard around that or policing. So just beware that do not ingest them. Okay, you really want to have the education and the knowledge of what you're doing. So the oils can be done aromatically, and so that could look like using a diffuser. I also talk about using a humidifier, which I have The Vicks is a great one. I have that on some of my YouTube videos. On the immune series, I show that. And you can actually put it in the spout, the essential oils, and be getting that as well as your diffuser. You could be doing it with the humidifier. I like the warm humidifier. And then there's also the little Vicks facial inhaler, which actually I used the other day. I need to use it again. But that will help clear out any sinus conditions, help the respiratory, the lungs to strengthen. And then I'll have like this little menthol pad and I put the oils on that. So that's another way to get your aromatic oils. And, when I'm seeing patients, I give them what I call a sniff ball. And all that is a cotton ball with a couple drops of the oil. And then they can I recommend putting it in a sandwich baggie, and a lot of times the oils will still smell really well for up to about a week. And they can just open up the baggie, take a whiff, open it up, have it going in their car, depending on what we're working with. So those are great ways. And then also you could use a tissue if you don't have a cotton ball. You could lay it on your pillow at night, depending on what we're treating. So many different ways to get creative aromatically. There's also the jewelry. I have a necklace that has different little pads that I can insert in there, and I can drop the essential oils on that. So you can even, wear it like that. And then topically, let's go back and let's do something fun right now. I wanted to do one aromatically with you, and I like to call this the Peppermint High. I do this with my patients. Peppermint is an amazing oil, and I like to read this because it's very impressive how concentrated essential oils are compared to herbs. 1 drop of Doterra's peppermint oil, show you the label here. 1 drop of Doterra's peppermint oil is equal to 27 cups of peppermint tea. So that gives you an idea of how powerful they are, and they work immediately. They're like 50 to 70 times more concentrated than herbs, and very powerful and effective. So we're going to do, since I've already talked about aromatic, and then we'll move into topical, and I'll just keep using the peppermint right now. We're going to do the Peppermint High. So if you do have a peppermint Doterra or even somebody else's, go ahead and grab your bottle of peppermint, and you can use, with Doterra, you really only need a drop or two. Make sure to stay away from your eyes. You do not want to touch anywhere near the eyes or cup near the eyes because it's very strong and can burn. And then if you get it in your eyes, you have to dilute it with an oil like a fractionated coconut oil, which Doterra has, or some other form of oil. So what I do is when we do the Peppermint High, this is going to help with sinusitis, sinus health, and also respiratory health. So I even do this pre-running, pre-athletics to help my respiratory endurance and really help my lungs open up and get me going. It's also very uplifting. So it's going to stimulate and open up all the senses. So I take a couple drops, rub it in my hand, and then I'm going to do an inhalation 3 times through my nose, and it's really going to start clearing out my sinuses, which is great because I've had sinus congestion. And then I like to hold that in for about 10 seconds just to let it go in systematically into the system. Within 30 seconds, it's going in through the body. So I'll do a couple more of those. Really great sinus health. And then you can get a head rush, so be careful. You might want to sit down. But you see, I'm staying away from my eyes. And then when I do the lung therapy, I'm going to inhale through the mouth. So I'm going to go. And then I like to hold that into my lungs and let that expand and open up the bronchi. And again, you may want to sit down because you can sometimes get a little bit of a head rush. And then what I like to do for topical is if you're having chest issues, lung issues, you could rub it right on the chest, kind of like a Bengay, but now we're talking natural plant medicine health. So there's not going to be any chemicals like Bengay. And also, if you're having muscle tension, discomfort, you can rub that on the muscles. I always end up rubbing it on my neck and shoulders and my back. But you just, anywhere you're having muscular pain, this is a really great oil for that. So there you go. That was the second way to use oils, which is topical. So we've all done the Peppermint High, hopefully. That should be awakening you and stimulating you. Really great if you have more work to do tonight. Just I don't like using peppermint too close to bedtime because it is can be very stimulating for me. Some people not, but for me it's stimulating. So this would not be one I'd use close to bedtime. The peppermint can also be used with ingestion, the Doterra one. So this would be a great peppermint tea. You could put a couple drops in some peppermint tea, 1 or 2 drops. You can cook with this one. So if you want to make some like a peppermint chocolate smoothie, you could put a drop or two in your smoothie depending on the flavor that you like, the intensity. And that can be very yummy. You can also cook with it. So if you want to make chocolate brownies, chocolate peppermint brownies, a really fun one. So, and then ingesting, you could also just take the little shot glass like I had before. Glass or stainless steel is best for taking your oils, ingesting. And then you could just take a drop or two, put it in with some water, and then shoot it. Another way, if you don't like tasting your oils, is you can put them in a veggie cap and take the veggie cap. So there's many different ways you can take the oils internally. You can also put a drop or two on the tongue or under the tongue, but you might want to have some water nearby in case it's really strong. So let me just quickly go through and read a few more little, there's a whole bunch of, this is the Modern Essentials book I shared with you all last week in the sharing essential oils class. And this might look a little blurry here, but this whole paragraph here is all the many ailments that peppermint can help. So when I'm prescribing for patients different protocols, I'll go to my Modern Essentials book, excuse me, and this is an older edition, and I'll look up various ailments and be able to prescribe, get a good dosing and way to use them for the patient so they have a clear understanding. So a few of things, as a lot of people already know, peppermint's really great for digestion, ulcers, if you've got stomach issues, and then I've already named some of the other ones. So we're going to move on to another oil that is one that I use a lot for my pain and inflammation patients, and it's called Deep Blue. It is a blend, and let me see, read which oils are in that particular blend, and then we'll do a little topical demo on the Deep Blue oil. So the Deep Blue is wonderful for decreasing inflammatory inflammation anywhere on the body. So this can be used for all types of pain. I use it on my knee patients, foot patients, neck and shoulder, low back, you name it. And then it's also really great just for general joint pain, fibromyalgia, bone pain, arthritis. So again, we're talking inflammatory conditions. So the different oils that contain in Deep Blue, in the Deep Blue blend, hold the bottle up here, is wintergreen, camphor. Now I did have a patient that just came in the other day and they had a camphor sensitivity. However, she was open to me putting just a tiny bit on the low back area that we were treating, and I don't think she had any reaction. She's coming back and I've not heard of anything. So just know that a lot of times when you get rashes and reactions to oils, like from other store-bought oils, they're not pure, so you could be reacting to the chemical that's added in there. Since we've got the certified pure therapeutic grade, there's a lot less reaction, depending on what oil, but there's a lot less allergic type reactions noted if you're using a certified pure therapeutic product. So that's what's so great about maybe spending a little extra and getting a really great product. So camphor, that's an analgesic. Wintergreen, which I already said. Peppermint, which we just used. Blue tansy, German chamomile. Helichrysum, which I do want to go into a tutorial on that because that's a wonderful oil. That's in the deep blue. And osmanthus, that's a flower found in China. So all of those oils are in the deep blue blend. It's also known as the soothing blend. And again, it's one of my top oils that I use in my practice because my specialties are pain and inflammation and mental health. But I can treat anything from A to Z. But I tend to get a lot of pain patients, and that can be pain anywhere in the body. So with the Doterra, it's deep blue. It's really great. See, this is the one I use in my practice. It comes in a lotion rub. So if you buy the lotion rub, it's going to come in a toothpaste tube, unless you want to go all out and get a really large one. I mean, if you're a practitioner, this is a great one to use. This is a 32 ounce. This has lasted me a long time. So when you are putting this on topically only, you're not going to ingest this. You could diffuse it, but I typically just use this soothing blend topically. So I'm running low, so I'm just going to show you here, but it's a lotion rub. A lot of people like this because it's very easy to spread all over an area that might have pain. And the beauty is you only need about a dime size for the area that you're treating because we're talking pure oils. And then you're going to always make sure you do not touch your eyes after you've rubbed it on an area. I'm going to go ahead and get some more on my neck and shoulders since that's usually my area that needs a lot of TLC. So, and then when I do massage on my patients, I will massage this all over their tender spots. So they're feeling pretty happy, and then I'm encouraging them, just go on home, don't shower, leave it on for the rest of the day, and shower in the morning because, it's doing its thing for at least up to probably 3 or 4 hours. And then always make sure you wash your hands after so you don't end up accidentally touching your eyes because then you'd have to dilute it with an oil to get that out of there. Okay, so let's go to the final oil that I wanted to share tonight, which is an On Guard blend. The On Guard blend is wonderful to protect your immune system, which is so important right now, being that we're going into the flu season with fall and all the other goodies that have been out there this year. So the On Guard blend, I'm going to just go through, and it's known to be an antiviral, antibacterial, air pollution, so it can be very good at purifying the air. This one I love using when I'm treating patients to make sure that I've got a very clean air going and antibacterial, antiviral. It's really cleaning out the air, keeping things fresh and clean to prevent infection and getting sick. So this is a great one. It's also great for chronic fatigue, which I did not know that. I'm going to start using this probably more. And colds, coughs, flu, and infection, even mold, it's stated. Mono, which I didn't know that. It makes sense though. Pneumonia, sore throat. A lot of times I'll rub that on my throat if I start to feel a scratchy throat to start warding off any bugs. So very, very good all around essential oil blend. And then this one has wild orange, clove, hold up the bottle, wild orange, clove, bud, cinnamon bark, rosemary, eucalyptus. So some really great powerful oils that have profound antiviral effects and antibacterial effects, antifungal. And this one can be used all three ways. So you can diffuse it, you can ingest it. So you take a couple of drops. There's also an immune balm prescription if you have some sickness or feel like you're coming down with something. Message me and I'll send you that prescription for the immune balm. And then it can also be put on topically. Now this one I would recommend, it can be hot and sensitive on the skin. So the fractionated coconut oil, which I didn't bring in my office here, but the fractionated coconut oil, you'd put a little bit of that with this, and then you could put it on topically on your throat, chest, wherever you're feeling the lymph. I often put it on the lymph glands. So very good for protecting the immune system. Okay, so we'll be wrapping up real soon here. The On Guard comes in many different forms. It's got the little On Guard beadlets. So these, there's a drop in each beadlet. You just bite it and then swallow. And I usually take 1 or 2 of those a day to protect my immune system and keep me healthy. They also have a lot of cleaner. So if you feel like you want to start going more green with your cleaning, less toxic cleaners. I love their concentrated cleaner. Also their hand soap is actually all I use because the soaps at the hospital are way too harsh for my skin. Actually cracks and bleeds my skin when I use the chemical soaps. So the On Guard, as you can see, they've got many different products from laundry soap. They've got throat lozenges, toothpaste. They now also have dental floss, mouthwash. They've got the On Guard in the soft gels, and so many variations of the On Guard blend. It's a very popular one. So overall, just to close, again, this is a great book. So if you're looking for a support, there's different, what am I saying? There's more recent editions out there. And then, so it's always good to have a resource in case your doctor's not available to help you, guide you. And then it's just good to get your own education. So Doterra has a science blog. You can look up blogs and read about them. Sometimes I post them. And we really want to also just be aware that the kind of what we call the wellness, the foundation pyramid, foundational pyramid to health starts with eating right, exercise, rest, and managing your stress, reducing toxic load. So all that comes under lifestyle, and that's where we become a team with our patients. And then healthcare, we've got informed self-care, teaching the patients how to use the different products and prescriptions, and being proactive with your medical care. So that is where I'm always encouraging my patients to set up a preventative health maintenance plan, meaning filling your tank on a daily, weekly basis, which is what I do for myself. I've been doing that for 30 years. So, and I can help you create that if you're like, well, what does that mean? What would I do? That's what I do with my patients to really empower them around their mental, emotional, spiritual, and physical health care. So if you're interested in getting some of the oils, there's many different ways you can get them. You can get them retail. If you want to get your own wholesale account, you can do that through me. I can walk you through. You can also go right to my oil website, but it's nice for me to help walk you through because I can show you different ways to really save and guide you to the best products that are going to be for your health needs. And also, if you have friends and family that need guidance, please do share this video and reach out. I can reach out to them as well. If you do want to save more, you can get what we call different kits. So there's like a small kit, a large kit of essential oils, and those are going to be like your basic pharmacy. And that way you're going to save more by getting like a starter kit. So the small starter kits I think run about 160 at a wholesale price, and the big bottle, meaning the 15 mil versus the 5 mil, is going to be in your large kit with the diffuser. That's $249. So that's a big bundle savings that way. Now, when I got my oils for the first time, I went ahead and just signed up like a Costco member. I paid the $35 annual fee. To renew every year, it's $25, but you do get a free peppermint each year when you renew your membership. But I went ahead and paid the $35 membership, and then I customized. I just picked what oils I wanted because I had certain ones I was needing for my own health. So that's another way that you can also get them, and you'll still save your 25%. So please reach out, and I can guide you through your plant medicine journey. And if you just want to, if you're not, just dipping your toe in the water with plant medicine, this is all new to you, you can also get them on my website or reach out to me. And I can also probably save you money if you're local, drop it off to you. And then when people purchase their oils, I do also like to do a one-on-one mini consultation. So you're really understanding how to use them, walking them through dosing, prescribing, and how to use them best for their condition. So as a doctor, I feel like it's my responsibility in order to address your needs and what's going to work best for you. So I look forward to engaging with you. Please feel free to put any comments in the box there. If you want to fill out the personal interest form, I can reach out to you that way. You can email that to me. You can subscribe to my YouTube channel. I'd love to see you there. Give me a shout out. Give me likes. That'll help the YouTube channel to grow, and I can keep providing more educational videos to you. I am hoping to connect my Facebook Live to the YouTube. Still researching how to do that. So if anybody has any tips on that, please let me know and send me the best way to contact you. So I know we went a little over tonight. I'm a chatterbox, and I love to be here to share and be of service. So thank you for being here tonight. I'm sending you my love and healing in your world, and let's stay connected. And I'll be here next week for another live class. Okay. Next week's class, I'm going to leave that as a surprise. I'll start putting that out on my social media. So if you want to follow me on social media, I'm on Instagram, Facebook, as you know, YouTube, and Twitter. Good night, everybody. Be peaceful, be kind, be gentle with yourselves.